Hello everyone, I'm Lenny Swanson with Pristine Technology Solutions, and today we're going to talk about the road to electronic health record solutions. Now, before we start, there are a couple acronyms that we need to make you very familiar with. They are EHR, EMR, and HIE. EMR stands for Electronic Medical Records. EHR stands for Electronic Health Records, and HIE stands for Health Information Exchange. Now, EMR. An EMR is actually the conversion from a practice that uses paper, when they convert from paper to an electronic application. Pretty simple. One practice, one conversions. The information is not shared. Now, an EHR is when multiple practices convert from paper to an electronic medical record application, but the difference is they have the ability to exchange the data. So an EMR to an EHR is similar to a tree to a forest. One tree is a tree, and a whole bunch of trees is a forest. Now, that is not the way it is right now. That's the way it's going to be in the future. And in the future, things are going to look extremely different, and that's where we're trying to go. Now, this is the model of what the future will look like. Those entities in red are the entities that we are currently trying to convert to an EMR, an electronic medical record solution. You see hospitals, physicians, clinics, small clinics. We have to get all of these entities on an EMR before we can begin to migrate towards an EHR solution. Now, once all of these entities have an EMR, how do they talk to each other? The term we mentioned earlier, HIE, Health Information Exchange, that will satisfy that requirement. Now, this is the Health Information Exchange. Once all of these entities have an EMR, they can exchange data between offices utilizing the Health Information Exchange. Once the Health Information Exchange is put in place, then the EMRs effectively become EHRs. Now, this program will be propagated all across the nation. You have HIEs on a state level, a regional level, and a national level. And this HIE will also act as a data repository, giving us the ability to run all kinds of studies, do all kinds of research in healthcare applications. All of these things combined will provide the providers and the healthcare industry with the means to provide better healthcare. Now, as you might be saying to yourself, how in the world are we going to make this happen? This would be extremely expensive. You're absolutely right. Well, this is going to happen by way of the American Recovery and Reinvestment Act, sub-act called the High-Tech Act. $39 billion was set aside to make this a reality. Now, for the physicians, in order to motivate the physicians providers to migrate to this solution, there are 17.2 billion reasons. $17.2 billion have been set aside just for you. Now, they're not going to just give you this money. They're giving it to you for a reason. The reason is they want the healthcare industry to provide better healthcare and more affordable healthcare for every American citizen. Now, to get this money, a little work is required. You're going to have to, first of all, purchase a certified electronic medical record, an electronic health record solution, and then secondly, you're going to have to meaningfully use it. Meaningfully use is a question that a lot of people have, a lot of people don't understand. So let's talk about it. Meaningful use has been broken down into three phases: phase 1, phase 2, phase 3. Now, important to note about these phases is the earlier you get started, the better. These phases get progressively more difficult or more demanding to accomplish. So if you start phase 1, during the phase 1 time period, it is a much easier process for you to migrate towards meaningfully using the EHR solution. Phase 1 consists of capturing and sharing data. Phase 1 starts in 2011. The other two phases, advanced clinical processes and improved processes, come a little bit later on down the road. Now, once you have purchased a solution and you are using a solution, to register to receive the incentives is a pretty simple process as well. First of all, you have to have an NPI number. most physicians, 99.9% of physicians, currently have an NPI number. You just have to access the NPI portal and ensure that all your information is up to date. And you also have to enroll in PCOS. Have to get a PCOS account. Some of you have that account already. And after that, CMS will provide an application that will allow you to upload specified reports to their site to ensure that you have qualified for the money. Now, when you do this, what is available for you is
Did I miss something?
yeah, go to the next one, okay. All right, yeah, okay. All right, when you do this, what's available for you, what's available to you is $44,000, and it's important to mention that this is per physician. Now, this $44,000 will be paid out over a 5-year period. The first payment begins May 2011, and it will be $18,000. And as you can see on the chart, you get paid for 5 years until you reach your $44,000 maximum. As you can also see, the longer you wait, the less money you get. It's important to note that if you are a Medicare provider, if you have not implemented by 2015, you will be penalized until you become compliant. You will be penalized a percentage of your Medicare reimbursement. Now, in order to receive these Medicare incentives for phase 1, you must use the application for 90 continuous days. Those reports that you run will be ran over a 90 continuous day period. That's how you qualify for the $18,000. For the additional monies, you're going to have to use the application, immediately use the application for the entire calendar year. And if you have a certified solution, any other requirements will be taken care of by the application. If you're looking at Medicaid, Medicaid is a little bit different. With Medicaid, your payouts, your incentives are $64,000 per physician. That's right, $64,000 per physician, and they're paid out over the course of 6 years. Your first payment is $21,250, and it's $8,500 each additional year. Now, Medicaid is a little bit different. Number one, you have until 2017 to become compliant, and if you do not become compliant by 2017, you will not be penalized, but you will not receive any incentive monies. Also, with Medicaid, there is no 90-day usage period for year 1. With Medicaid, all you have to do is to adopt, which broken down means you simply have to purchase a solution. You have to purchase a solution, and you will receive your incentives monies in May of 2011. For the second year, you have to use it for 90 days, and the third and fourth year for the complete year. But it is really simple to participate into this program. All you have to do as a provider is to adopt or purchase a certified electronic health record solution, and you qualify. Now, to qualify, there are rules and regulations around that, and it basically states that you have to have 30% of your patient base be Medicaid patients in order to qualify you for this program. And there are a couple other ways you can qualify, but that is pretty much the simplest way. Now, all this information, all these dates, May 2011, many of you say, well, what is the rush? What is the rush has been a question that has been asked for probably a couple of years. Here's an example of what the rules were last year. Now, last year, the rules are set up in this manner. You had to qualify for phase 1 in 2010. You had to qualify for phase 2 in 2011, and you had to qualify for phase 3 in 2012. Well, if you started your implementation in April of 2010, and the implementation takes about 4 months, a typical implementation. For 2010, you had to use the application for 90 days, 90 continuous days. So if the implementation takes 4 months, and you had to use the application for 90 continuous days, and you had to use it in 2010 to qualify for payment in 2011, you really had to get started around April. Start looking in April, and we gave you a buffer month just in case things didn't go right. Well, if you started in April, you would be paid in January 2011. If you waited until June 2010, you could not get your 90 days in the year of 2011. So you would miss the first round of qualification, and you had to wait until the second round, which required an entire year. So you would have not gotten paid until January 2012. And if you waited until September, you would have not gotten paid until January 2013. If they had stuck with this plan, this direction, less than 10% of the providers in the country would have qualified. So they made the change. People, when we spoke to providers about implementing a solution, everybody thought they had a lot of time. And the result, because the government wants this program to be a success, is they had to sort of modify the rules, but they won't continue to do that. So when you say, what's the rush? The rush is you need to get started now so that you can start on phase 1. And so this migration from the paper world into the electronic health record world is a smooth and less painful one. Now, there are other reasons as to why you should actually go ahead and do it now and why you should not wait. And we'll talk about these reasons. Cost reduction. A lot of insurers are now offering malpractice insurance savings for providers who utilize electronic health record solutions. It's much like purchasing a home alarm system for your home. It causes you to get a discount on your homeowner's insurance. Then there's forms and paper and ink. Most practices spend a minimum of $5,000 a year in paper, ink, and forms alone. Minimum. A lot of money is spent there. EHRs can really reduce these costs. And then there's labor savings. There are a lot of categories where you can really save in labor. In fact, we have a cost labor analysis tool that we can give the practices, and it's really simple. You just type in the amount of time it takes you to perform these type tasks. For example, how long does it take to pull and refile a record? Questions like that. The questions are very simple. You just put in 5 minutes, 10 minutes, 1 hour, 2 hours, and it does a calculation for you. A cost calculation. Puts a dollar sign to it. In fact, on this next slide, we'll show you numbers from an actual practice. In this particular practice, the average hourly rate of the front desk people in the medical systems is $16 an hour. This is not the doctor. $16 an hour. Now, in this particular practice, they had about 35,000 charts. And they said it took them about 9 minutes to pull a chart. So the question was asked, how many charts do you pull a day? They said about 33. We use 20 to be conservative. 20 times 9 is 180 minutes, which is 3 hours. They work 4.5 days a week, and that breaks down to 216 days a year. So 216 times 3 is 648 hours. 648 hours times $16 an hour is a little over $10,000. So they spend over $10,000 just pulling and refiling charts. With the DMR solution, to perform that same task, $112 as a savings in labor of over $10,000. There's also other reasons as to why you should do it now. There's revenue enhancement. With EMRs, they have built-in schedule reminders. These reminders will call patients automatically, send patients emails automatically, tell patients about recurring visits, do this stuff for you automatically. If you have 100 patients, if you contacted 100 patients using these services, and an additional 10 showed up because they were reminded, that's a 10% increase. All of these types of recurring visits, they can be placed on the call reminder system as well. So it takes the work out of the practice and it notifies the patient so they're more apt to come. And the more patients who come to your practice, the more dollars. And then we have efficient billing, improved accuracy of coding, and diplomatic collections. Let's look at billing. This individual works for a free clinic, and in fact, if you have some free time, please donate. But the job that she performed was for one of the major insurance companies. And her job was to reject at least 3,000 claims per month for all kinds of reasons. It wasn't a difficult job, but they had the power. EMRs, what they will do for you is they will help you in submitting your claims to ensure that all the information is correct, so you won't have to deal with this. Now, Currently, in the nation, the national average for rejection for claims is 32%. Time of reimbursement, 30 to 90 days. So what we did was we made up some numbers here. These represents the service level codes from a practice. And yours probably looks pretty much the same way, a whole lot of level 3s. But basically we used 20% again to be more conservative. And we said this particular practice, they submitted all these claims, and this is what they were paid for the service level codes. So they billed a little over $437,000 for the year. 20% were rejected, so they were time to reimburse, if you will, $350,000. That's a decreased cash flow of $87,000. Now, with the EMR solution, you can get that number down to 1%. Not only that, you can get your money back within 7 to 10 days. Same scenario, you just increased by 3 months your revenue $83,000 by using an EMR solution. Again, these are the reasons as to why you should implement now and why you should not wait. It gets even better. Doctors, for some reason, providers are notorious for undercoding. There are a lot of different reasons, but they often undercode. EMR solutions, they have built-in functionality that's tied directly to the 1997 E&M coding regulations that allow you to code properly. And it helps you so that you can actually bill for the work that you do. In this case, we simply decreased our level 3 codings from 17%, and we increased our level 4 coding by 17%. And just by doing that, not any more work, just by coding properly and getting our levels correct, we just increased our revenue by $34,000. And I don't need to tell you that the numbers that we're using for these examples are pretty low. It gets even better. EMRs have built-in, EMRs, EHRs, they have built-in collection functionality. In other words, they will handle all of that for you. You don't have to make any phone calls. You don't have to do anything. You simply just have to run reports. For example, with patient statements, good systems out there will allow you to generate all your patient statements, have it mailed, printed, stuffed in envelopes, the whole 9 yards for less than 70 cents per patient statement. If you think about it, right now you pay 44 cents for the stamps. Then you have to print it on the paper, you have to buy the paper, you have to buy the ink, you have to buy the envelopes, you have to go to the post office, you have to have a resource doing all that. A good EMR solution will take care of all of that for you for less than 70 cents. And that's a real nice enhancement. And when it comes to collections, you can handle all those functions, features and functions for you as well. And all you simply have to do is to sit back and click and read the reports. Just that simple. Then there's improved clinical efficiencies. Now, with these tools, with all of these reminders that they have, it will allow you to it will allow you to remind the patients on appointments that they have, and if the patients show up for appointments that they have, perfect example, an annual physical. If a patient is reminded they have an annual physical 2 or 3 times, and they show up for the annual physical, you're actually providing better health care to that patient. You're helping the patient help you provide them with better health care. And then there are legibility issues. They go completely away. There's no more misunderstood or misinterpreted handwriting. Everything is type printed. Medications management. EMRs come with drug contradictions, drug age contradictions, drug allergy contradictions, drug weight contradictions. It reminds you of all of these things. If a provider was to prescribe a patient with 4 different drugs, and the patient was taking a couple of drugs that they didn't know about, and it's in their chart, it will automatically remind the provider that there's a contradiction here. You may want to take a closer look. A lot of bad things happen with misprescribed prescriptions, and so this goes greatly to help reduce that. And then you have patient portals. Patient portals allow the patients to have a direct interaction with the office through their patient portal. They can put in all of their personal health record information. They can track their personal health record information. They can update the kids' personal health record information. They can ask the office questions, ask for prescription, request appointments, receive lab results. All this can be done from the secure patient portal. and it will allow the patient to get all the information that they need and require less work from the provider's practice. Then there's improved staff morale. We talked about that earlier. And in the office, many times, so much paper is being moved around that it is impossible for the people in the office not to lose medical records. This is a statistic that we think is a little low, but it says 1 out of every 10 paper records are lost or misplaced. All you have to do is to go to a practice, or in fact, if you work in an office, you know that to be the case. They say that the average office spends 400 hours a year looking for lost or misplaced records, but actually it's quite a bit more than that, and I'm sure you can attest to that. And then with the office, it's always the fault of the office staff. The providers, you never ever lose any records. So an EMR will alleviate this problem completely. You cannot lose a record with an EMR solution. It is virtually impossible. Then, here we are again. Avoid the late rush. Don't wait till the last moment. If you do, it pretty much leads to bad decisions. If you rush, always leads to a bad decision. Rushed implementations. The implementation process is tedious enough as it is, and it's time consuming. It requires work from the office. Oftentimes work that the office has to find time to do. So you don't want to have the implementation rush, and at some point the costs are going to start to get more absorbent. They're going to get higher. And then as we talk about the 3 phases for qualifying, it gets harder from one phase to the next phase if you don't start at the previous phase. In other words, if you start at phase 3, it's much more difficult than if you were to start at phase 1, phase 2, and then get to phase 3. There are a lot of savings out there for you. There are a lot of benefits. In fact, the government has something called Tax Code Section 179. Gives you the ability to write off $134,000. Now, we are not tax accountants, but consult your tax attorney or tax accountant about this program. It's really helpful for you. It makes implementing this solution in terms of cost a really, really, really easier process. Then we have what we call blockers. There are 3 of these, called the 3 C's. Change, control, and commitments. These are the reasons that many providers wait. These are the reasons that many providers will not act upon this technology that can save them so much time, make their practices work better, give them the ability to practice better medicine, and also put a little funds in their pockets. Now, these blockers are change, which is a lot of things going to change. Change is difficult as it is to start with. People are kind of nervous about it. They don't know what to do. There are testosterone issues. I don't want to feel like I don't know what's going on. Then there's the culture. The culture of how a doctor office actually runs. The way doctor offices are ran now was started about 110 years ago. So everybody, my father did it, my grandfather did it, his father did it. They pretty much ran the same way. So there's a major change with that culture and all of the work that goes on in a doctor's office and all the different duties and responsibilities. And then in these difficult economic times, providers are having some hardships, even with finances. These systems cost money, and you have to come up with the money, in fact, all this other stuff in there on top of change, and it makes it a difficult process, which is one of the reasons why a lot of providers won't move. And then there's the control issues. Some providers say, well, I'm concerned about my data. I don't have total control over my data. I don't understand this technology thing. I don't have total control of the process. I feel unsure about it. This is one of the reasons that prevents doctors from moving forward. And then lastly, commitment. Believe it or not, many providers have actually started the implementation, but they don't see it through. They hit a bump in the road, and they stop, and they revert back to what they're comfortable with doing, back over to culture again. But the bottom line is, it's inevitable. It's going to happen, and you need to get on board because there are many benefits in this industry revolution for you. These are some of the reasons. These are some of the possible financial benefits that this solution and implementation of this solution can provide to your office. And these numbers are real. And any vendor you work with should be able to sit down with you and talk to you and come up with some number in terms of benefit. We're not talking long term. We're talking 1 to 2 year benefits. And this is on top of the incentive monies that you will receive if you properly comply. Now, before you buy any solution, we recommend that you ask yourself these 3 questions and be able to say, without any shadow of any doubt, yes. The first question is, can I save the money that I'm spending for this solution? The second question is, can I make the money that I'm spending for this solution? If you spend $100, can I save $100? And then on top of that, can I make $100? And the third question, will this solution make my life better? Will it make my life better? If it makes your life better, it's going to make your job better. But at the end of the day, do you want to be stuck in your office completing notes? Or do you want to go home when the office closes? Do you want to go to your child's football game or their recital or their dance? Do you want to do that? Do you want to live? Do you want to free yourself? And if you can say yes to all these 3 questions, then the solution that you're looking at is probably a good solution. Now, these are our criteria for selecting a good solution. Real simple. Do not overcomplicate it. First, the solution must be certified. That's really easy to do. There are government websites that you can go to and you can look at it, and if the solution is certified, it will tell you there. Second is really important and often overlooked. The solution must be easy to use. You don't want a solution that is certified but it's so complex that you don't want to use it. Make sure that it's easy to use. And then thirdly, it needs to be affordable and the pricing needs to be simple. A lot of vendors say, this is my price, and then when you finish with the add-ons, the price is absolutely, totally different. You need to be aware of that. You need to understand that completely. You need to have capability to interface with HL7 format that allows the data to be exchanged with all the different tools and the different EMRs out there in the industry. You must have good training. That's critical. Training is critical. If you're going to cut costs anywhere, do not cut it on training. And then thirdly, or lastly, good support. You must have good support. Now, a successful implementation, this is what is required. With a successful implementation, you must have an enthusiastic project leader. Now, this project leader is the person that's in your practice. The person that's leading the implementation in your practice, they must be enthusiastic. They have to want to do this. They have to understand it's going to take some work, because this person will cause your implementation to fail quicker than anything. And the next thing is training. If folks don't know how to use the application, they will not use it. Now, you have to have a plan, and your project plan should be a project plan that you can look at and within a minute understand exactly what's going on. It should be written in that language so that you understand what's happening. Got to have a good product and vendor. That goes without saying. Your infrastructure, it speaks to your technology, your equipment, good computers. If it's an internet connection, if it's a hosted solution, is your internet connection reliable? If not, do you have a backup? Those types of things. Then you have to have solid support from the organization that provided you the application. If you make a phone call, somebody's there to answer it with the question in a language that you can understand. Make sure all your tasks are completed quickly as they are assigned to your practice, which goes back to the project leader. And then everybody needs to be involved. Everybody needs to own this migration from paper to an electronic health record solution, because it's a practice thing. It's not a 1 or 2 individual thing. And if you do this, your implementation will be successful. Now, typically what happens is you get stuck with doing a lot of these things. Customizing your software, calling, trying to set up the interfaces, making sure your network is proper. You don't know anything about that. And quite frankly, the practice should not be involved. Those tasks should be offloaded to the vendor to do it for the practice. The practice can be along the side, but they need to be the front runners and guide you through the process. Now, this is the Pristine way. When we implement a solution, there's 4 phases. There's the assessment phase, the pre-implementation phase, the implementation phase, and the post-implementation phase. In the assessment phase, basically, we come to your practice. We perform a workflow assessment. We look at how you do everything that you do in your office. And also, we take a look at your hardware. We ensure that your hardware is qualified or has been provisioned to meet the needs of what we would need it to do. And if it does, we will tell you. If we can upgrade it, we'll upgrade it. If you need to purchase new hardware, we will tell you where to purchase it, where to get the best price. After that, we come back with a report. We have a discussion. We make sure that you understand the complete cost details of what's going to happen and how it's going to happen. At that point, if you're pleased, then we sign a contract and we go to work. Now, during the implementation, any vendor should hold your hand throughout the entire process. People and their staff in the practice, they are not technical folks. They, most of the time, don't know how to use an EHR solution. They're not familiar with it, so someone should be there so that if any question comes up, they can answer these questions and make this migration an easy, painless implementation and just remove the fear. They should be there with you throughout the entire process. And after the process is over, we have a post-implementation survey. There's an evaluation of how you're using the product, and we actually contact your office once a week, minimum, for 6 weeks to ensure that everything is going well. And then after that, we provide continued support. Are there any questions? Okay.